So I'm a diabetes specialist at the Hospital for Sick Children, and we're engaged in research in youth who have type 1 diabetes, and specifically looking at risks and onset and progression of diabetes-related kidney disease. So we've been involved with a research study called AdDIT, which is the Adolescent Diabetes Cardiorenal Intervention Trial. Our focus is prevention. We know that the teenage years and adolescence is a period whereby diabetes-related kidney disease can start and it can progress due to a variety of factors. And our primary focus is to identify those individuals at risk and look at a prevention-based strategy, so they do not sort of have progression to further risks of kidney disease. And as much as we can, we want to focus on health. We don't want to focus on disease. And I think that's what drives us. We have at our hospital, there's a large plaque that says care for what the child will become. And I think it's very important for us to look at a model whereby we can prevent disease as much as when we look at treating disease. So the challenge is always about, informing, about educating, about partnering, about sort of opportunities for research studies that can engage the patient in questions that they want answered. For example, how do we identify people who may be at greater risk, and how do we prevent disease from progressing? And I think any study that is looking at doing that, you have to ask your patients, your partners, what is the best way to do it? What language do we use? How do we reach you? How much is too much? And that's where sort of that give and take comes through, and I think you have to listen. And I think that's what I've learned from a clinical research perspective, is listening and taking a step back from what you may think may be the best thing, and also trying to sort of reach a place whereby we can sort of get great work done, but we can also maximize the patient experience and ultimately, I think, improve quality of life.
Right away. I just really wanted to be a voice for people. I wanted to be able to have projects that were going to make a difference in people's lives, and I wanted to be part of that, and I wanted to have a voice. And so I made a decision at the beginning that I would, in June of 2015, that I would be involved. So it was my renal specialist that asked me if I would be part of it. So I bought in right away. People are just, they're always wondering, and they're always asking, like, what are you guys doing differently? Like, how are you guys doing it? Like I always talk about, it's like we have this magic formula, and I think our magic formula is our building the relationships, and that's what we're doing, is we're building relationships between patients and caregivers and renal specialists and researchers, and we're building that relationship. And building the relationship and building the trust is the most important part of any type of a project, and to be able to have the patients have their voices validated and know that they're going to be heard. And that's one of the things that I feel as a patient advocate, that I know my voice is going to be heard. I think as an Indigenous person that I really, maybe not totally, but understand a lot of the barriers out there. And for me, when I was first diagnosed, I had a family physician. I live in Winnipeg, in the center of Winnipeg. So I had a family physician. I had access to care. And in even communities that are an hour and a half away from Winnipeg, they don't have a primary care physician. They don't have anybody to when they start to get sick or when they think that something's wrong. And that's why something like the screening project is so important, to be able to have the screening project for people to be able to know what their risk is. I look and I think I had access to care. I was screened. All of those things were done. My disease was caught early. And, I was able to receive treatment, an aggressive form of treatment. I was very sick, but I was able to be well. and that doesn't work for most of the Indigenous people that live in Manitoba. Their access to care and all of those things are just not there. And I've been able to hear it from people, and I've been able to see it. As an Indigenous person, bringing relationship building to the process and asking researchers, so what are you doing to make sure that you are, your research participants are going to be of Indigenous descent? What are you doing? What is your plan? What is your engagement strategy? Do you have one? We as Indigenous people, I mean, everyone knows that kidney disease has a strong impact in our community. And you need to understand those reasons of why it's affecting our community, but you need to be making sure that you're reaching out. And so I've been able to ask researchers those tough questions, and then been able to help the researchers to make contact and to start that process. And it's an honor to be doing that.